Hello, welcome to the next episode of CGI Talks. Now, if I've asked you that, or if I've given the statement that for the last 3 years, or even more than that, one of Germany's most prestigious award-winning doctor in the area of neurosurgery was an Indian origin doctor. I'm not sure how many of you would trust me in this or believe in this, but that is a real fact. Today, we have with us a distinguished guest who has had or made his mark in the area of neurosurgery and has taken a bit of his gracious time just for us to have a conversation about this topic. So with that, we are glad to have Dr. Karthik Krishnan as a guest for CGI Talks. Sir, welcome to CGI Talks.
Thank you. Thank you for having me.
Based on your profile, sir, there's a lot to unpack, I would say. So let's just gradually start off breaking the ice, get to know your background and your early days and beginnings. So in India, where did you grow up and, how did your childhood days be?
I was born in India, in Madras, and at that time it was Madras near this Chennai, in a township called Mylapore. So I grew up with my grandparents till I was approximately 10 years of age. Because when I was 1, my brother was conceived, and when he was born, it was a little bit too much for my mother. So I grew up with my grandparents. So for a time, I've been telling everybody that I have 2 moms and 2 dads. So it was a sort of temple atmosphere. I grew up in it's called Agrahar, temple house. And then when I was 10, then my dad took me, and I grew up with my parents in a place called Tanjore. My father was a biochemist. He was teaching biochemistry. He was professor of biochemistry at the medical school. In Tanjore at the time. He took me there, and from that time, I went to a Jesuit school, St. Anthony's Jesuit school, and that was a very sports-oriented and very dedicated school. And the saying among the Jesuits: "You give me your child till he's 7 years of age, and we will make something out of him." Yeah. That was type of school, and was very fortunate to have that kind of education. And then later on, my dad got a transfer back to Madras, and back to Madras, and that is where I finished my schooling. And then after schooling, I started to study physical therapy. First, I studied chemistry in the Madras Christian College. And after that, physical therapy in the Madras Medical College. At that time, we had some cultural exchanges, and we had very good connections with Russia. So I went to a Russian culture center to learn the language and to learn the culture. And we used to play chess there, or hold arts exhibitions, and I used to paint at that time, and now too, sometimes just illustrations. So that gave me exposure to another country with a different language. So there I got a scholarship. Then I moved for medical studies to Moscow, to Russia, and that is where I did my medical education. The primary medical education. So that was around 80s. It was 88, 87, 88. So I finished medical school there, and I started to train in plastic and reconstructive surgery. In Moscow. Got it. And then I did some research projects, which brought me to Germany. Interesting. And I came for my PhD in Germany at Munich University, and that's where I did my thesis. I finished my thesis there. I got it. So that's much about them as the childhood. In a nutshell. So from Mylapore to Moscow, it's an interesting journey to Munich. Then all M's. So the inspiration of
neurosurgery, and you had an interesting story about an inspiration that came from a movie. So I'm just curious to know.
Yeah, we had a chat about that earlier. In India, they used to show, Doordarshan used to show late night movies, and one of the movies which we saw there was, the name of the movie is a Polish movie. It's a classic. It's called as a quack. So quack is a person practicing medical sciences without having a license to do so. So there's a famous neurosurgeon there in Warsaw, and he loses his memory because his wife left him and took his daughter. Then he wanders in search of his family, his daughter, and he doesn't know who he is, but he has his skills. Yeah, so whenever some problem occurs, he was there. He works in a mill, and as a just common worker, and people who broke their bones or some medical problems, they come to him and he sets the bones up or he closes wounds and so on. So one fine day, a young woman gets into a motorcycle accident, got it with her boyfriend, and the local doctors refused to accept her because she was not wealthy. She couldn't pay for it. So this guy does a complex removal of a brain blood clot in a setting which is completely in a village. Okay, got it. And later on, the movie goes on like, he's being sued for that. Quackery is prohibited. And then some of his former students recognized him and said, "This is Professor, this." And just to see that, and it was very inspiring. And that was probably, and of course, one of my father's closest friends, he was a neurosurgeon, so that was also an influence on me. So neurosurgery was always, moreover, as I grow up and as I started studying medicine, and the brain is one of the organs that can comprehend itself. So to be able to manipulate it and to be able to do something is thrilling, isn't it? Well, okay. Yeah, so inspiring. Okay. So that was one of my motivations.
Okay. Yes. So from Moscow, when you came to Munich for your thesis, was your thesis also based on neurosurgery?
Nope.
Okay. It wasn't.
No. I practiced plastic surgery, or plastic and reconstructive surgery, not the cosmetic surgery, but hand surgery, reconstruction of burns, and closure of defects or cavity surface on the surface. So that is a stepping stone for me into surgery itself. Surgery was a passion, and so we did research on venous flaps. You can raise flaps and move around the body without sacrificing an artery. Okay, can we just, based on the veins alone, can you fashion a flap to use for soft tissue coverage? That was my topic in all my PhD thesis.
Mm-hmm. Mm-hmm.
And after that, I got a job in a lab, in an epilepsy lab, where I could do some microdissections of the brain. And okay, I started as a lab doctor. Also, I'm doing research. Yes. Okay, got it. A clinic in Grossalen. That is my first step into neurosurgery. Okay, got it. And at last, then neurosurgery was my wish ever since I was a child. And it just happened.
Like Paulo Coelho says, yeah, you think of a thing and the universe conspires for you to.
Yeah.
Yeah. Yes. So another factors, looking at your profile, in your early years, once you were about to graduate, you had this humanitarian experience where you were also in a warfront situation and all, right? So as a youngster who is getting into this field, how did it kind of, if I can use the term, humble you about this profession, about the profession and also about life in general, those experiences?
Yeah, thank you for asking me this question. It's at that time I was living in Moscow. So in Russia, the healthcare system is centralized. Like unlike in Germany, it is decentralized. Like even the small villages here have units which can handle a lot of problems, but not in Russia. So Russia, they had a fantastic sanitary aviation. They used to call it sanaviation, sanitation. They transported patients from the periphery. For example, somebody's working in the fields and got his limb chopped off by a machine, and the patient would be transported to the center within 24 hours so that the limb can be salvaged and resewn to the body. So this was very well organized there. But then it was a time in the 90s when Chechen War came up, and then they bombs were falling everywhere, and civil casualties were there. So they couldn't transport that much. I mean, if it's one patient, they can't en masse. They can't do that. So they asked who volunteers. So I was 24, 25 at that time, and of course, Rosny was war-ridden, the city, and maybe I was a little bit adventurous, and probably I wouldn't do it today. Maybe, and maybe I would. I don't know. Depends on the situation. So that time I volunteered because I also, it's not exactly, it's nice to wrap it in with a phrase humanitarian, but it was to tell you the truth, to be very, very true, and it was adventure seeking undoubtedly for me, and I wanted to gain experience. So that gave me enormous experience. Okay, being there in Grozny and having to operate whatever material was available and to be creative. Understood. That is exactly what is required of this profession. Yeah. So whether you can do with what you have and help the patient. Understood. Okay. Got it. Within that time frame, and that kind of experience I had in Grozny, which was a booster for me. Okay. So the learning still stays with you. Oh yeah, certainly. Okay. Okay. So then you traveled across the world. I mean, it was not just Moscow to Munich. I mean, you've also been in US, UK, and also Africa or other regions of Africa, and also your background in India. So you eventually landed up in Germany. I mean, was it a chance or choice that you ended up here? A bit of both, I would say. Chance because I got the scholarship, the German Academic Exchange Scholarship, which supports, it's called the DAD, which supports foreign scientists to work within Germany and German scientists to work in other countries there and gain experience. So this scholarship came up and I applied and I got it and I came here. And after that, our children were born. And you cannot, when you're alone and when you're just two of you, you can move around, but when you have children, then you have to settle down. So it's about school and it's about education and all. Okay, got it. So moving to the segue of the topic of this and talking about Germany. Now, how do you think is the current medical system established in Germany with regards of doctor-patient ratio, and also in specialized areas like yours? Is it a growing trend? Are there resource availability? How do you kind of see that? Yeah, from my point of view, from the point of view of a doctor, I would say there are enough doctors for enough patients. So healthcare system in Germany is probably one of the best achievements of mankind, I would say, because you have an insurance system which covers everything. Be it the president of the chancellor of Germany, or be it an immigrant, they get the same kind of treatment. Probably the president would have a uniformed personnel delivering papers and cake for the afternoon, but otherwise, the implants you get, the type of treatment you get is of the same high level, high quality. So that is a great achievement, I would say, which is not so in many parts of the world, many developed parts of the world. It's not like that in France. It's not like that in the UK. It's not so in US. The one good thing about Germany is they like to criticize themselves, which is great.
Understood.
Because there is a self-reflection. Yeah, there is a opportunity for growth there. Yeah, when you start looking at things critically. But from the global point of view, Germany is fantastic. It's one of the best care providers in the world.
Got it. Okay.
So from this point of view, you can say that they have achieved a certain amount of level of expertise in healthcare, which is unparalleled.
Got it. A related question to that is, with the modern age and information age, there is also the stereotype that people keep out there. It's a bit latent and delayed. Be it also emergency services, you have a long delay in getting doctors. And the family physician would say, just drink quickly, sit at home, even if you have a cold. So the expectation level is growing. So do you think these are just kind of voices out there as a person who's behind the curtain who is experiencing all this?
Let's take two categories. One is an emergency medical service where somebody has a heart attack or a brain bleed. So this needs to be dealt with right away. So if you call the number, the ambulance will be there within the next 10 minutes. And you'll be rushed to a hospital which has this facility.
Yeah.
So this infrastructure is extremely well established in this country. So you will be taken care of.
Mm-hmm.
There is no waiting. There is no losing lives. There are no losing function and so on. If it is possible, it will be done.
Okay.
When it comes to the second category, the elective cases, like somebody requires a knee replacement, or somebody has a slip disc, then the waiting periods might be different. Again, with a decentralized system, there are specialists everywhere around Germany. It is not one big hospital which is providing this kind of care. But you take all the smaller hospitals, they all have departments where you can get these things done. So the waiting time in comparison is not that high as it would be, let's say, in other parts of Europe, like in the UK, where I'm born. And,
Interesting. So looking at this also from a perspective of, potential, I mean, as you said, the system is very robust over here. It provides a lot of opportunities for new talents who are coming over here. Now, looking this from an Indian lens, we always have this thought processes globally. India provides a lot of talents and human potentials, majorly in IT and healthcare, as they kind of use it, if I can use the word stereotype. Do you think this is an existing, or this is a valid statement, or do you, what are your views on that? That
you see, India, when I look back, my early years, is it is what it says. There is unity in diversity. There are a lot of different cultures, a lot of different people, languages. They just unite together, and they are passionate about what they do. So be it art, be it science, be it mathematics. So we cannot talk about India being a supplier of something, but because of this upbringing, because of this being introduced to you from the early age on, children are passionate about what they do. So that pays off. So if there is a person who is very much interested into information technology, and there is a lot of scope for this in some, you should look at it as the world is your canvas. So where you're required, you go and do it.
Yeah.
Right. So you cannot confine yourself to a particular Asia or Germany or something. Right. So if there is a opportunity there, we are ready to take it. So I still consider myself not as an Indian or a German or it. The world belongs to us. Yeah. So from this point of view, it is like we have given our children and our people this possibility, which I'm very, very proud of. So it's you can decide where you die, but you cannot decide where you're born. So I was fortunate to be born in India.
Yeah, that's a nice way of putting it. So yeah, I mean, very valid point. And seeing us as a global citizen would make a big difference in that point of view.
So what difference does it make if you work in California or in UK or in France, or the language is a barrier. You have to learn it. And again, if you have the capability of learning things, you will learn a language too.
Yeah, got it. Right. Okay, so let's now dig deep into neurosurgery and specifically the growth of technology. Now, if you look for the past 10 years, technology and its growth has been pretty fast if you compare it to the years before. So right from your beginning days, from early 80s, how have you observed in neurosurgery, neurosciences, how has technology been influencing this whole area?
Enormously.
Okay.
Enormously. There's a huge leap because even during my training years, I'm just going to give you an example. So there's a cavernoma of the brain, a very small blood sponge, which causes epileptic seizures. So it is quite small in size. So to approach it is quite invasive.
Okay.
Let's say it is like you have a cherry in your yogurt and you have to pick the cherry out without just disturbing the yogurt. All right. But so during the early years, we just have to use some coordinates. So the human brain is, it's like it's a brain. And so somewhere in the depth that is sitting there, it's a deep-seated lesion. So you have to find it there precisely. So during the 90s and the early 2000s, the neuronavigation came up. So neuronavigation is just like our GPS system, which sort of navigates you right to that point so you can approach this lesion without causing much injury to the normal structures, eloquent structures.
Okay.
Thus preventing possible undesirable side effects like speech loss or loss of motor function and so on.
Okay.
So in the beginning of the 2000s, there were huge conferences which discussed only neuronavigation, right? But nowadays it is just every day. Every hospital has a neuronavigation. So this is routine. It's like your WhatsApp or, I remember when I was a student, I couldn't call home. I have to stand on a line to a telephone booth where I have to call my parents. And now you just call free of charge everywhere in the world. So it's not so much time has gone.
It's okay. So just curious, doctor. So this particular technology that you said, how has that specific technology evolved? Like, was it initially a wired format or was it a chip or,
No, this is like you take the coordinates of the skull and the brain from a preoperative imaging, let's say an MRI or a CT, and then you use those coordinates to orient yourself during surgery.
Okay.
And there is something called this live navigation where you have an operating suite where the MRI is integrated in the operating room. So as you're operating, you can do an MRI.
Okay.
So intraoperative MRI. Okay. Also, there is speech monitoring. There's neuromonitoring has played a huge role in the last 20 years. And so other things like, what you're talking about chip is brain-machine interface.
Yeah.
That is still in the process of developing. So for people who have lost the control of their extremities or, function of the extremities, how do you transmit your thought process to a certain movement? Well, I want to move my hand. I just think about it and move it. So what if this transmission does not occur? Call it. So that way you can pick up signals from certain parts of the brain using a microchip and transmit it to a machine interface, which sort of effectuates, which sort of starts stimulating a particular muscle group. So this is in the very early stages, right? But even now, God, this was one of my research points when I was doing my, in Germany, you do in order to become a professor, you have to do 2 levels of thesis. The first is a PhD, and the next one is a postdoctorate thesis. So that was one of my topics. So for that, I got it, where you can use a brain-machine interface to control body parts.
Understood. Okay. So zooming out on this topic and, looking this from a larger picture, like every industry has this debate between traditionalists and modernists, when it comes to technology and its usage. Do you also have the same debates happening in the neuro?
And neurosurgery is modernistic. There is nothing traditional about it. If you take, there was a famous picture which is called as the Stammbaum der Medizin. It is the ancestry of medicine. So it's like a tree, right? So the stalk of the tree and the roots of the tree is internal medicine. So this has been there since times unknown, right? From ancient times. And orthopedics or surgery itself, or plastic surgery, which originated in India. So, sorry, did you say plastic surgery? Yeah, originated. That was Sushruta Samhita. How this describes the reconstruction of the nose, because amputation of the nose was a punitile measure at that time, and so people thought about how to reconstruct the nose with flat cerams. So this is the first steps of plastic surgery in all. So. And plastic surgery originated in India, and it was brought to the West by English settlers much later, centuries later. So those are the roots and the stem. Neurosurgery is one leaf. So if you take neurosurgery as a specialty, it is not more than 100 years old.
Okay.
So everything about neurosurgery is modern.
Okay, got it.
So formerly, you had to do a mainline surgical training before you enter neurosurgery. But at some point in time, about 20 years ago, people said, we will train our own neurosurgeons. So they just embarked into neurosurgical training right after medical school.
Okay.
So formerly it used to be you have to do general surgery, and then you have to do neurology, and then you have to combine these both skills and do a certain amount of time in neurosurgery, and then you become a neurosurgeon. So they say we'll train neurosurgeons ourselves.
Okay, got it. So another hot topic currently in discussion is also the influence of AI and automation in different areas of work. So how has this also influenced the neurosurgery area?
AI has not played its main role yet.
Okay.
Today, it's still in development. All right. So as we know it today, it is based on algorithms which we feed them. All right. So it's certainly used in diagnostics. It's certainly used in, again, I tell my students that, when the imaging technology is so very important in neurosurgery, because if it's somewhere outside in the body, you can see and feel, and you can palpate, and you can auscultate, and you can see what is happening. But within the skull, everything is closed. So imaging is the important thing for knowing what is happening inside the brain. So MRI imaging, or PET CT, or PET scans, or whatever imaging we have. So I tell my students, we don't treat images. Let's say we treat patients. Let's say there is a chronic subdural hematoma. It's a blood clot which has formed at some point in an elderly person who had a minor trauma, and this blood clot liquefies, and it forms something called as chronic subdural hematoma. So if you take AI, it would say, well, the width of the chronic subdural hematoma is more than the width of the bone. So this is an indication for surgery. So this is what we know. This is the thumb rule, that if the thickness of the hematoma is more than the normal structures, then you have to go and operate and take it out.
Mm-hmm.
But what if the patient is doing fantastic with that? Can we wait and observe?
Okay.
So these type of decisions have to be made by human beings that have studied the patient, that have examined the patient, and it's patient specific. So at the moment, it is still there. Got it. But at some point, probably you can go to a counter and talk to the counter, and the AI will tell you, yes, you are a good candidate. You have to be operated, or you don't need surgery, even though you have. I can imagine that happening in about 50 years' time, or maybe less.
Okay, so that's also another question related to that I wanted to know is, I've had a chat with a couple of doctors who said that AI had made that admin works more easy, be it report generation or things like that. So do you think that human touch that you mentioned is also going to reduce a bit, if that's a word I can use, with the influence of such technology?
Uh, Again, it is about passion. If you are passionate about uh, doing something, and if you are passionate about what you do, you will not lose that. I mean, people want to see people still. We have an aging population. Maybe it might change in, let's say, 100 years or 50 years, where the next generation gets older. But for the moment, it is still, if you have a patient, parents want to be treated by doctors who are people, and not use algorithms to do that. And elderly people, they want to see other doctors who are in flesh.
Okay, coming, before coming to our closing remarks, let's try to understand your current job profile, and also based on your experience, you also have a teaching experience, is currently what I understand. So, and you also have other doctor-based communities that you also represent. Can you elaborate on those?
Well, I'm a neurosurgeon, so I practice neurosurgery at one of the county hospitals here. I'm attached to the Gießen University, so I teach there to students and to young specialists, and I hold lectures. I'm a part of several neurosurgical societies. The most salient one is the Sunderland Society, which is dedicated to the study of peripheral nerves, and also the German Society of Neurosurgery, of course. Okay. So this is basically my profile. Okay. And my subspecialization is everything that has to do with watershed areas between the main neurosurgery and the main plastic surgery. It's tumors that grow through the integument, and which involves the brain and the skin and the bone. So removing the tumor at the same time, reconstructing it. So yeah, those are my specialty areas. Or brachial plexus injuries, where a person lost the function of an arm because of injury to the nerves, to reconstruct that. Okay. Not only the primary nerve reconstruction, but also secondary reanimation strategies like muscle transfers and tendon transfers. I do that all. Okay, so that's my specialty area. Okay, got it. So I can group it up as reconstruct neurosurgery. So I will call myself a reconstructive neurosurgeon. Okay. So the teaching gives me great pleasure. So I love to be among students, and I love to do the anatomy work. So I frequently go to the anatomy lab and work with the students. Okay. To study the anatomy and to learn surgical techniques.
Okay, got it. So is it? Do you have like a structured plan over there, like this much hours at the clinic, at the hospital, and then this much hours?
Or twice in a semester, it is a must. Twice in a semester, teaching. But again, I do clinical research. Like I have PhD students attached to me. Okay, got it. Who come and analyze our patients and analyze our results and publish them, and I help them get them published. Okay, got it. Keep the manuscripts together with them. I like illustrations, so I draw illustrations for all my publications myself. So I know that. Okay. So this is, again, when I was growing up, I was very passionate about painting and drawing. So this just shows off. So
interesting. So do you do this physically or right now digital art?
So I do it on iPad now.
Okay.
5 years ago, I used to do it with pencil on paper with color pencils, and then scanned it and digitally labeled them with. So now I do it on the iPad.
Wow, interesting. So yeah, so that's
again, there's something, when you're, you can earn money, you can lose the money overnight. But if you have knowledge, you can never, you have skills, nobody's going to take it away from you.
Yeah.
So this is what I would like to tell young students and other aspiring people, it doesn't matter, doctors or otherwise. And the best investment you can do is to invest in yourself, to improve your skills. Like Warren Buffett says, the great investor.
Yeah.
So the best investment you can do is to invest on yourself or your skills. Nobody can take it away from you. If you are a doctor, they put you in prison, you're still a doctor there. So you use your skills.
That's a nice way of saying it, sir. So with that, let's come to the closing remarks. And I wanted to specifically ask this because we live in a world that's getting attention deficit. The whole smartphone culture and social media culture is just making people very tough to focus. And you coming from a profession and from a passion, I would say, where it requires deep focus and concentration, what would be that message that you would like to give to a wider audience in that world?
Let's go into that. How is the impact of social media on the present situation of education and attention, so on? You see, media has changed. The ways of learning have changed. So we are in the beginning of a new way of education, new way of learning skills and training. So in the beginning stage, it might appear like attention deficit, but indeed it is not. The basic thing is the drive, the interest. If you have the interest to know something, formerly you read books, formerly you spoke to people, but now you have media, which gives you this information. So you're going to get your information. The main thing is to want something. Okay. If a person wants so badly to do something, he will find ways, be it through media, be it through YouTube or TikTok or whatever. This information is done. So our brain is craving for that information and for that knowledge. Okay, so where it gets it from, it depends on what we have, right? Formerly, we didn't have these, so we had to go and talk to teachers and talk to people. And now the world is our teacher, so it's going to change. So, okay, we're in the beginning of that.
Okay, so coming to the point of focus and passion for things that you do, you mentioned about, loving what you do, and that would just...
That is something which we have to be sure that our children have, that they are passionate about what they want to do. The next generation of people. But if they are passionate about what they want to do and they really love what they want to do, then they will find ways to do it. So that is something which is the seed. Once you implant the seed, where it takes the moisture from this.
Yeah, it's egg, as they say in German. Okay, great, sir. It was a wonderful conversation, doctor. And I would have loved to hear more from you. Let's see how the diaspora is, getting help out of this information that you shared. And once again, really proud that, you are also representing the diaspora group over here, as an Indian origin doctor. And regardless, as you said, we are all global citizens. Again, thanks for all the works that you're doing, and looking forward to seeing more of you out there. So
thank you.
Thank
you very much.